all of our pelvic organs where they need to be, and sometimes for different reasons, pregnancy, menopause, things start to guest. I'm a physical therapist assistant at Benchmark in Cape Junction. I also have been a massage therapist for 15 years. I have been a physical therapist assistant for 5 years, and I have been treating pelvic floor patients for 4 years. Most of my patients are incontinence patients, women. I have treated some men, but more on a consultation basis for erectile dysfunction and prostate problems. I also wanted to introduce Chris Williams. He is the physical therapist at Benchmark in Cape Junction. Sarah Ward is a physical therapist, a clinic director, and the
multi-site director. She's the clinic director in Grants Pass. And Judy Mayo is another physical therapist assistant in our office. And John Neely is our accounts manager. We can thank her for our lunch today.
There we go.
So I'm going to talk to you today about common pelvic health problems, what the current research says, how we're going to help our patients, because pelvic health is a multidisciplinary effort. We can't do this alone. And you can go to the next slide. The urinary incontinence is a big one. This is mostly what we deal with. Mostly women, but we do deal with men. And here you can see that it's all ages. We're not dealing with just with old people. We're dealing with 18-year-olds, 17-year-olds, 16-year-olds. 75% of nursing home residents are incontinent. There's also a correlation between fall risk and incontinence. So if we can try to get some of this incontinence under control, maybe we can get some of the fall risk under control. And it's not just a woman thing, because you can see here, men deal with incontinence too. 71%. That's the number of people who have incontinence and their medical professional has never asked them about incontinence. As healthcare professionals, we have to do better with this. And financial impact. It's huge. We're looking at $82.6 billion a year that we're spending on incontinence. This is the cost of pads, laundry, dry cleaning. Women who wake up and they have urinating on their bed, now they have to clean their mattress. They urinate in their cars, now they have to clean their car seats. And most of this burden is on the patient. $1,969 every year that the patient spends on pads, laundry, dry cleaning.
Hey, it helps me more than that.
There's several different kinds of incontinence. There's stress, which is coughing, sneezing, jumping, bouncing, and you have clear urine leakage. There's urgent incontinence, that is, you just have it, that the muscle around the bladder just contracts involuntarily and you have urine leakage, you have no control over this. Mixed is very, very common to have both of them together. And nocturia is when you are urinating in your bed at night when you're sleeping, and a lot of times they wake up in the morning and they're wet and they don't remember. And this is our evidence that physical therapy works. In a random control study, in a Cochrane review of 31 random control studies, on the groups that received physical therapy reported an 8-time cure rate of their incontinence. So physical therapy does work. Next, we're going to talk about prolapse. And prolapse is basically a herniation in the vagina. So our vagina is open, and usually strong enough, and those ligaments are strong enough to hold all of our pelvic organs where they need to be. And sometimes for different reasons, pregnancy, menopause, things start to loosen up, and those organs actually fall into the vagina, and sometimes they will fall out of the vagina. And this is a cohort study of 9,000 women. This is after they have had one baby. And you can see that we have 90% of these women have a uterine prolapse, and that's where their uterus is actually starting to fall down into the vagina. Another 90% have a cystocele, that's the bladder. So the bladder is sitting here and sits here in the front, and it's actually falling backwards into the vagina. Rectocele is where the rectum falls in. Your rectum is back here in the back, and it's falling forward into the vagina. 65% have a grade 2, and the grades are rated by how far the prolapse is happening. 0 means it's not anywhere. Grade 1 means it's gone down about a centimeter into the vagina. Grade 2 is it's reaching the hymen remnants of the vagina. Grade 3, it's going past the hymen. Grade 4, it's actually coming out. Most of these women were asymptomatic. They didn't even realize that they had herniations. And there's a lot of different symptoms. Sometimes women will feel bulging or pushing or pressure down in their vagina. They'll be washing themselves in the shower, and they'll actually be able to feel this bulge. And they get scared because here they are falling apart. That vaginal tissue is not supposed to be exposed to air. When it gets exposed to air, it cracks, it bleeds, infection. And some women actually have to use their fingers. They will insert their fingers into the vagina to push the bladder up where it's supposed to go so they can urinate, or they'll push their rectum up where that needs to go so that they can defecate. And there's great evidence out there that says that pelvic therapy works for prolapse. We teach strength, coordination, and we have good results with this. Next, we're going to talk about chronic pelvic pain. This is women who have, or men, who have pain for more than 6 months with no diagnosis. Low back pain is very common with these patients. 1 in 7 women between the ages of 18 and 50 have chronic pelvic pain. Results in a lot of gynecologist visits and a lot of surgeries. You have pain, we're not sure what it is, but let's go do surgery. There's a lot of different causes of pelvic pain. One that I found that was very interesting was that vaginal deliveries have a high result of chronic pelvic pain over cesareans. And physical therapy is very effective in this. 50 to 80% of women show progress with pelvic pain. A lot of times these women are high tone patients. So if we can teach them to relax their pelvic floor and teach them manual therapies, they actually make really good progress. And it's not just a woman thing, we're also dealing with men. And 50% of men after their prostatectomy report incontinence, and 1 to 5% a year later are continuing to report incontinence. And this was a random control study where they took 2 groups of men, one that had physical therapy before their prostate surgery and a group that only had the prostate surgery. The group that had the physical therapy before the prostate surgery, when they had their surgery, they took a little tiny biopsy of their pelvic floor tissue and they looked at that under a microscope. And there were histological changes, so it works. And these men had 62% less incontinence, and 75% did not need to wear a pad. And what's the role of PT? First, education. We teach our patients about their bodies, about what's happening to them. Education is 90% of what we do. We also teach muscle control, muscle strength, muscle coordination. It's not just about Kegels. There was a study that shows that 1 out of every 5 women, only 1 out of every 5 women were unable to perform a Kegel correctly. But after cueing, most of those women were able to perform that Kegel correctly. There was also another study that was done just in 2022 that just came out. Random control study with two groups of women. One group of women only had pelvic therapy. The other group of women had pelvic therapy and hip strengthening. They reported decrease in continence and decrease in pelvic pain. So again, physical therapy works. And how do you get to see your patient? How do your patients get to pelvic therapy? First and foremost, they do need a prescription. We can see them without prescriptions if their insurance allows it. And they can also self-pay because most of the time we only see them for 3 or 4 visits. So it's not like they're coming to us for 3 or 4 months, 2 or 3 times a week. They would have to see Sarah in Grants Pass first because she's the physical therapist, and then they could follow up with me with the rest of their appointments. We have had success with Sarah in telehealth, so they don't have to drive to Grants Pass if they don't want to.
Great.
And internal exams. We don't have to do an internal exam. I think we prefer to, but we don't have to. I cannot do any internal work unless Sarah does an internal exam first. But Sarah cannot be the first healthcare professional to provide that healthcare exam. Another medical professional, gynecologist or primary care has to provide that first. And these are my resources, and another page of resources. I will make copies of them if you would like them. Any questions?
I think we're just.
How many patients do you want?
Be not having to the telehealth with Sarah and then going to you. That's a big. I know all pelvic floor physical therapy we've had to send to a Asante because we just haven't had the knowledge of anyone here doing it. So you being here is definitely going to be huge for a lot of our patients that are looking for pelvic floor strengthening. So that will be good.
Yeah, I would say that, for telehealth, it works well, but it's not the best sometimes. Yeah. So I know some therapists are like, unless I do an internal assessment, this is not considered pelvic health. And I disagree. I want to meet the patient where they are. Yeah. And if the patient is not ready for that, I'd rather them come in so we can continue to work with them and educate them and not do an internal assessment that first time.
Yeah.
Some people are nervous. Some people have had abuse. Yeah. Some people, and it's hard. I'm not going to be that strong-willed with it. So if somebody though needs that, then we need to get them in, of course, to the clinic so that I can see them and then send them out here to share.
Yeah.
So.
Perfect. No,
and then for follow-up, so the way that it works is about every 30 days, we do need to do a follow-up. Those follow-ups are great to do telehealth, just to make sure that they're doing okay. If they don't want to drive in here with the cost of gas and all of that, time, those kinds of things.
Yeah.
So,
perfect. No, I think that's great.
How about men that have had a total prostatectomy? They have had, I know, some PT like in the hospital, but a year or so later they're still suffering from a lot of incontinence. Can you help them, do you think? Or?
We can absolutely try.
Okay. All right. I got a couple of them like that they did have PT, but I don't know what kind of PT they had. I mean, I just don't know. Okay, well, I'll talk to them when I see them next time. And then I've got several women. I think that most of them are elderly, and we have tried them on, different medications, and they don't work. So I'll go ahead and send them to you. Does the insurance pretty much cover this?
Yeah, if they're gonna cover physical therapy, they're gonna cover this.
Okay.
Yes.
Okay.
Yeah, we use the
Because
same.
that's gonna be the big, is this gonna be covered?
Yes.
You know, that's the
Yeah.
question.
We use the same codes. We use therapeutic exercise and activity and all of that to bill, so it's no different.
And we can just go ahead and use incontinence as
Mhm.
our diagnosis.
Yeah. For the men too, I mean, this is for everybody, but
Yeah,
for the
yeah.
men, I would say that if they've received a little bit in the hospital, you know, and then they haven't received anything outpatient, it's going to be extremely beneficial to them, teaching them coordination and fine
Right.
muscle control. Because a lot of times with men, especially, men don't even know they have a pelvic floor. So to teach men that they have a pelvic floor is step one, you know, and then to teach them like, here's your core and this is how we activate. Because a lot of times when they do it, they're going to bear down and give 120%. You're like, no, just 30%, please. So all of that and the breathing, not holding your breath, those can all make a huge difference for them.
I saw some guy on TikTok the other day, just teaching pelvic one, and he went down and I thought, I don't even think I can get down. But I did, but then I didn't understand at that point, so I
Right.
thought it was kind of interesting. So
Yeah.
at least they're even putting that stuff on TikTok now.
Yeah.
Or men who, like, before they went into surgery, having them come in so that their surgery is that much more successful afterwards.
Yeah.
So.
Anytime you have a break, you can hear it coming from your office.
And
TikTok.
There's a lot of stuff that they're good
You gotta learn those dances.
Okay.
all of our pelvic organs where they need to be, and sometimes for different reasons, pregnancy, menopause, things start to